Thank you for joining us at the Shop and Compare today, sponsored by Preferred Primary Care Physicians. My name is Lance O'Brien. I'll be walking you through the Medicare education. We have about 15 minutes to go through a ton of information today. We're really focusing on the top 7 questions as it relates to Medicare, and we'll be able to provide some answers after for you. So who can get Medicare? Biggest thing here is generally most people age in at the age of 65. You do have to be a U.S. citizen or a legal resident of the United States. You can get Medicare early if you have a qualifying disability or an immediate diagnosis. An original Medicare stands for Part A and Part B. So what does Part A and B cover? So Part A, on your card, the red, white, and blue card is going to say hospital. I like to refer to this as your inpatient services. And then Part B says medical, and I like to refer to this as the outpatient services. So on this slide here, you can get a good idea of some of the things that are covered by Part A. It's not simply inpatient hospital. It could also be skilled nursing, hospice, home health care. So, but primarily it's all of your inpatient services. We're going to talk a little bit more about costs for Part A in just a minute, but what is important to know is you can't be denied coverage as long as you meet one of the guidelines of citizenship and work. And then the coverage is nationwide, meaning if Part A is your primary insurance, you can go to any hospital that accepts Medicare. Part B, again, these are your outpatient services. So like outpatient surgeries, specialist, primary care, MRIs, emergency room, ambulance. You see a lot of those services there on the screen. So again, what is original Medicare? Part A and Part B. Part A is your hospital or inpatient coverage. Part B is your medical or outpatient coverage. Again, can't be denied coverage on Part B, and the coverage is nationwide. So if Part B is your primary insurance, you can see any doctor in the country that accepts Medicare. And there are some premium penalties and other things that can happen here, which we'll get into a moment. So we've covered what it covers. Let's get into what it costs. So for Part A, for most people, it's premium free, meaning you don't have to pay a monthly premium. As long as you've worked 40 quarters, 10 years, paid into Medicare and Social Security in your lifetime, you won't have to pay a premium. Now, once you have or have signed up for Part A, if you use the hospital and you don't have any private insurance, there can be significant costs. As you see on the screen right now, we got some TBDs because the 2024 numbers are not out. But just to give you an example, if you had Part A, no supplemental insurance, no Medicare Advantage plan to back it up, and you went to the hospital for 1 to 60 days, it would be $1,600 deductible. Day 61 to 90, $400 a day. Day 91 to 150, $800 a day. Biggest thing you need to know about the Part A, beyond it being free, is there's no out-of-pocket limit. The way that I like to say it generally to people is it's free to have, but it's not free to use. And quite frankly, Part A without any kind of insurance to back it up can become very expensive because there's no max out-of-pocket, no parachute. Okay, Part B costs. This one is not free. There is a monthly premium for everyone that is on Part B unless they also qualify for Medicaid with their Medicare. For 2023, the standard premium is $164.90, which is going to go up here in October. We're going to get the new rates for 2024. And that premium, that standard premium, can go up based on your income. There's a rule with Medicare called IRMA. It's an acronym, Income Related Monthly Adjustment Amount. So depending on the amount of money you make as a single individual or a married individual, you can pay an elevated premium. Now that premium is paid through your Social Security if you're taking it when you go on Medicare, or you'll be billed quarterly. Part B also has a deductible that is not yet determined for 2024. For this year, it's $226. And I'll say for the premium and the deductible, they have a tendency to go up $5 to $10 a month each year. So maybe we might be in the 175 range. We'll be getting that information out as soon as it becomes available. But again, big thing with Part B, you're responsible after the deductible for 20% of the services. There's no maximum out of pocket. And frankly, this is the problem with original Medicare, the red, white, and blue card. There is a lot of risk because there's no max out of pocket for either Part A or for Part B. So the big question that people ask is, how do I get more coverage, or where do I get more coverage? Because as we get older, we get on a fixed income. What we don't want to worry about is a health situation wiping out our life savings or a good portion of it. So there's a lot of ways to get private insurance. You could actually have coverage through an employer that extends, although that's not very common these days. You could have veterans coverage or TRICARE. But for most people, they're actually going to choose their insurance through the two options on the screen. In red, you see a Medicare supplement, or maybe you've heard the term Medigap, and then a Medicare Part D plan. And then there's also in the blue a Medicare Advantage plan. These are the two types of coverage that most people are going to choose from when they go on to Medicare. And as we jump into a little bit more detail on both of these, the first thing I want to say is one of these is not right, one is not wrong. You may talk to somebody and says you should do this or you need to do this. It's different literally for everyone. And when we meet with you one-on-one after the shop and compare, or you call in and talk to one of advisors online, which happens a lot, they'll walk you through all of these options as we move forward. So what is a Medicare Advantage plan? Well, let me give you an overarching principle and then some things people like and don't like about them. The overarching principle is if you go with a Medicare Advantage plan, it completely replaces original Medicare. Original Medicare, again, is Part A and B. That red, white, and blue card, if you choose one of these Advantage plans, is going to go in your safe somewhere. You're not going to need to take it to the doctor's office. The Medicare Advantage plan is actually going to be the card you show at the doctor's office, at a facility, at the pharmacy. Okay. Now, what people like about these plans, every single one of them has to provide a max out of pocket. So the parachute you don't have with A and B, you get with a Medicare Advantage plan. People also like the fact that these are very affordable for additional coverage. A lot of companies actually provide zero premium Medicare Advantage plans. So for no additional money, you can get extra coverage, better copay structures. You can get the max out of pocket. The other thing that people really like about the Medicare Advantage plans is they cover things that original Medicare Part A and B do not. So you can get your Part D prescription drug plan built right into this plan. You can get coverage for dental, vision, hearing. There's a lot of plans out there today that have flex cards or payment cards, over-the-counter items, free gym memberships. So people like the comprehensiveness of it. So again, max out of pocket, low copays, low premiums, and a lot of the benefits that Medicare doesn't cover. What they don't like about it is because Medicare is no longer primary, they don't have access to the full Medicare network anymore. Now they're in an HMO or a PPO. HMO, Health Maintenance Organization, PPO, Preferred Provider Organization. In that one-on-one meeting or phone call, we'll get into more detail about that, what that entails, but that could limit your network just a little bit compared to original Medicare. And then the other thing people don't like is these Advantage plans, they only have to be as good as original Medicare. So it doesn't mean that every copay is going to be better than original Medicare. Let me give you an example. There's some things that you still have to pay 20% for if it's a Part B charge. So again, could be some out-of-pocket risk up to the max out-of-pocket. All right. And then on this screen, again, you see kind of an overview, all the benefits of Part A and Part B. You can get prescription drugs and all the extras built in with that max out-of-pocket to help against high costs. All right. The second insurance would be a Medicare supplement or a Medigap. Big thing with this is this works with original Medicare. So if you go with this, you go to the doctor, you're going to show them the red, white, and blue card and your Medigap card. They work in tandem. And what people really like about this is the network. Medicare remains primary, so they can go to any doctor or hospital. in the country that accepts Medicare. Secondarily, they like the fact that because Medicare is primary, they have a first payer, and then the supplement is the supplement or the second payer. So there's not a lot of out-of-pocket costs with supplements. A medical emergency is never going to become a financial emergency. So people that like to travel a lot, people that like to or have a lot of health conditions when they turn 65 and need to see a lot of specialists, this could be an attractive option for them. And they also like that even though these are provided by private insurance companies, they like the fact that these plans, these Medicaps, they go by letters, F, G, N, you may have heard of that, are actually standardized by the federal government. So the government has oversight of what they provide and everyone has to provide the same coverage. So that's what they like about the supplements. Really, the only thing people don't like about the supplements is they're more costly up front. You have to pay for your Medigap plan. Then you also have to get prescription coverage. So there's a premium for that. It doesn't cover dental and vision and hearing other than what is medically necessary. So again, there can be more out-of-pocket costs when it comes to these situations. So we've got the Medicare Advantage plan, we've got the supplemental plan. And I know that was a quick overview based on time, but again, that's what the follow-up phone call, the follow-up appointments are for. We walk through in deep depth about how this pertains to your situation. Part D, this is how your prescriptions are covered. You can either get your prescriptions through a standalone Part D plan or integrated into your Medicare Advantage plan. You do have to have a prescription plan when you go on Medicare within 63 days, even if you don't take prescriptions, or you can start accruing a penalty. Okay, so you're probably familiar with how prescription plans work. Everyone has a formulary, a list of covered drugs, and then a tiering system. The tier 1's less expensive generics, tier 5, your more specialty medications and such. Medicare works the same way, whether it's standalone prescription drug plan or a Medicare Advantage plan. Now, there's 4 phases to the drug coverage. I'm not going to spend a ton of time here because they're actually revamping this for 2025. Just know that you could pay a deductible depending on your drugs. It's a little bit over $500 a year. And then in the initial coverage phase, as long as your retail cost of your medications is under $5,030, you pay copays for your medication. Once it goes above that, you may have heard of the donut hole. You go into the donut hole, you don't pay copays anymore, you pay co-insurance, 25% of the retail cost. So your costs elevate this time of year. And then the last phase, catastrophic coverage, there's no cost for your brand names or generics at that time, as long as they're covered by the Advantage plan or the standalone prescription drug plan. And again, a lot of information. It's what the follow-up phone calls and appointments are for. So how do you choose? Well, again, one's not right, one's not wrong. What we found is once people really understand them based on their budget, their travel habits, things of that nature, they determine which one's going to work best for them. We help simplify that process here at MediConnect. And then when can you enroll? Well, the initial enrollment period is a 7-month window of time that revolves around when you first turn 65. So 3 months before, the month of, and 3 months after. This could take place at 65 if you enroll in Medicare right at 65. If you work for a couple years and you have credible coverage and you stay on your employer plan, this initial enrollment period could start at age 67 when you retire. But you have this period of time to make those decisions. And this is where if you miss your enrollment, you could get the penalties and all the things that you hear about. Again, when you sit down with us or talk to us, we make sure that you avoid all of that. And it's important if you're thinking about working past 65, very important to actually review your group coverage and Medicare options, another valuable service that we provide to the Senior Care Advantage through the preferred primary care physicians. And then when can you change your coverage? So there's multiple enrollment periods. We just looked at the initial enrollment period. There's the Medicare annual enrollment period that runs from October 15th to December 7th. Basically, for 7 weeks every year, anybody on Medicare has the ability to review their plan and make a change that goes into effect for January 1st. We provide those yearly reviews at no cost to all of our clients. It's a great asset as your health changes and as the plans change. And then we have the Medicare Advantage open enrollment. This is from January 1st to March 31st. This is specifically for people that have Medicare Advantage plans. They get another window to change their coverage. And the reason for this is the Advantage plans change more regularly. And then last, we have special enrollment periods, which are based off of qualifying events. So there's a lot of them: leaving group coverage, moving from one location to another, qualifying for some help through the state or the federal government because of financial reasons. Again, we go over all of this. This right here is meant to give you an overview, a macro level view of how Medicare works. And then we get into the nitty-gritty details in the follow-up phone calls and appointments. So again, I'll be available to answer some questions. We thank you so much for being here today. If you need additional help, you can call or text the number you see on the screen there, 412-730-3045. You can also email help@mediconnectins.com, and we'll be able to walk you through all of this. Thank you so much for attending today. We look forward to assisting you.